Hi, I'm Dr. Thousand, and I'm here to teach you how to keep your gingival graft clean. So before I talk about the specifics of oral hygiene, I want to talk about the two worst things you could do for the health of your graft. Number one, pulling on your lip. I know you really want to see what it looks like, but pulling on your lip does some serious damage to the outcome of your graft. Second would be to bite into something very hard or rough, like a sandwich made out of French bread. Instead, I'd like you to chop your food into small pieces and chew it on teeth that aren't anywhere near where the graft was placed. So, I'd like to talk about hygiene in basically 3 separate time zones. So the first is time 0 to 2 weeks, which is essentially directly after the graft was placed. I'd like you to use nothing but a mouth rinse. And this is because if you were to brush or floss, you'd probably disrupt the graft. I don't want you to use a mouthwash in the conventional sense, whereby you're vigorously rinsing the mouthwash throughout your mouth. I want you to use it more delicately, and I want you to gently just nod your head back and forth, just slowly bathing the graft. And I want you to do this for 30 seconds for twice a day. So from weeks 2 to 6, I want you to utilize a roll brush technique. For the roll brush technique, I want you to utilize a soft toothbrush. The one I've got for demonstration purposes here is a gum post-operation toothbrush, super soft / ultra supple. The technique is one where you'll start with the toothbrush bristles on the gums, almost perpendicular to your gums, and then you roll the toothbrush from the gums to the tooth surface. Anywhere between 10 and 20 strokes should be enough to keep that area clean. You don't want to overdo this. This needs to be nice and gentle. Place the bristles on the gums and roll. So along with the roll brush technique, I want you to start gently flossing. Essentially what I want you to do is get a long piece of floss, and I want you to place this floss gently into the contact and then slowly work it through the contact on either side, and then lasso the tooth, pull the plaque out, lasso the tooth, pull the plaque out. All right, so it's going to go just like this. Sure, through the contact. See how easy I took that? One side. Other side, and then through. So for the third time frame, which is basically 6 weeks and on, I want you to use a traditional brushing technique, which we teach most of our patients, the modified Bass technique. So the modified Bass brushing technique utilizes a 45-degree angle where the toothbrush is placed into the sulcus, and the sulcus is where the gums meet the tooth, okay? You place it at a 45-degree angle with 50% of the bristles on the gums and 50% of the bristles on the teeth, and then you make circular vibration movements and then swipe it away from the tooth. And that, folks, is how you keep your graft clean after surgery.